All right, we're back. We're gonna do a C-Spine. All right, so we're gonna go to browser, and then we're gonna go to scheduler here, then patient registration, and type in patient info. All right. Remember, you only have to fill out the bold parts of this card. So if you have any emergency and you have to start your scan quick, just make sure you fill out anywhere where it's bold, or else it will not let you scan. You see how exam is not highlighted here? Head, so exam. You see how it now highlighted head exam? That is correct. Exit out. Look at all these type of C-spines. We're just gonna do a nice simple one here. All right. So once again, we're just gonna do whatever planes. One plane of each: a sagittal, coronal, and axial. But as you can see, this is our protocol here. When you don't want anything, remember, all you gotta do is click trash can. It's already highlighted. Trash can, already highlighted. Trash can. And we're not gonna do all these. We're just gonna do these three here, and then the rest is copy paste. All right. So this band here, all right, helps with motion, artifact, or artery flow. So we want to put it near the spine. Here's the spine. So we're gonna put it close, but not too close, because then it'll brush it out. Okay. We're gonna angle everything here on how the spine is going. All right. So we're gonna count. Make sure we get all 7. If you can get T1, that's great. This one doesn't look. I'm gonna say that's 2, 3, 4, 5, 6, 7. This is T1, so we can get T1 here. All right. Want to make sure we don't get that. Put it where the spine's at. Want to make sure we get the whole spine here as well. All right. You know what? Let's throw in 2 more slices here. Yeah, that's better. All right. My motto is the more the better, right? Because if you don't give them enough, you would have to bring back the patient. Okay. Now, this scan is 4 minutes and 40 seconds because it has 3 averages. The more averages, the more I want to say 4K or better quality resolution. Your images are going to look more sharp. Okay. But since we have a volunteer on the table, let's not make it too long. All right, so I cut down an average, and you see how it cuts down the time. I cut it by a minute. All right, let's start this. So 2, 3, 4, 5, 6, 7, T1. All right, right to my right. All right, coronal. Same thing. You want to get the whole spine, front to back. Okay. You can angle with the way the spine's going. And I'm not sure if you saw on the last one, your face direction was head to feet. I don't know if you saw the oversampling was going up here and down here. Now we are at right to left. So you have oversampling. Okay. Because we don't want this to overwrap onto your spine. Alright, we're going to wait for the sagittal to be done. And here, face oversampling. Phase, so it's at 70. I think the most you can go is 100. And look how much more of 25 will give you here. You hit enter. Okay. But look what it does to the time. 2:41. Let's go back to 75. Enter. It's only 11 seconds. It's worth it, you know. If you have a big guy, big girl, you know. And this one again, averages 3, 241. If we take one out, 149. Curvature, huh? So 2, 3, 4, 5, 6, 7. All right. So here, you want to make sure you get the spine here. Okay. The main thing is to get the spinal cord. Okay. All right. Sorry about that. So the main thing to do is get the spinal cord. All right. And it looks pretty good. Remember, angle with the spine. And if you want to get everything, the whole spine, will add more slices. But remember, the more slices you add, the longer the scan. Alright, probably take away some here. There you go, that looks better. Get everything. Good, good. I can drop it to 2. Okay. Alright, now let's set up this axial here. Alright. So for this one, we get from 2 to T1. As long as you get C7, you're good. But once again, if you're able to get T1, that's great. So 2, 3, 4, 5, 6, 7. T1. So we can cut down some slices. 2, 3, 4, 5, 6, 7. T1. Maybe too many. Okay. That's better. Alright. So now, here's your band again. Alright. you don't have to open it all the way up. All right, and once again, we're gonna angle with the spine here. All right, looks pretty good. Let's check our TR. Go down a little bit. It's a long scan. All right. So now we're doing a corona right now, then we're gonna do an axial, right? And then we're done. Okay, but now we have another sagittal, an axial, and another sagittal. So remember, I'm gonna show you how to copy your parameters, okay? So this is a sagittal, so we can only copy it from a sagittal, okay? So we're gonna go to the sagittal that it was already ran. You're gonna right click, copy parameter, and this one has a sat band here, so you're gonna do slices and set regions here, okay? It's gonna say it's gonna raise that, okay? There it is, set the same way. But let's see what happens here. 672 for a T1. You want to be below 750. All right. Can we do one more? No, we can't. It goes to 1260. Okay. All right. And then you hit apply. You move on to the next one, axial. So we're gonna copy off this axial. Right click, copy parameter, slices and sat band here. All right. Bingo. Just like that. Okay. Good. Apply. Then we're going to do one more sagittal. Okay. All right. You can copy out this sagittal or this sagittal. It doesn't matter. Okay. This one's closer. Copy parameter. Change that. There you go. What do we got here? So we'll take one out. It's not bad. Just like that. Hit OK. And that's it. You're done. You set it up. Hopefully the patient's nice and comfortable, and they're able to do what, 10 plus 13 more minutes, and they'll be done. But we're not going to do that for our volunteer. We're just going to do 3. All right, let's look at this here. Nice. Good job. A little curvature here. Less than 2 minutes to go. Now, sometimes it's a great idea to ask your patient if they want to be bothered with time remaining. You know, some patients, they want to know how much longer. Well, without them asking you, ask them up front. So you let them know, would you like me to tell you every time a sequence is about to start? Or would you like me to tell you when you're halfway there? You know, just the more comfortable the patient gets, the better for you. Your images will come out better, less motion, and they won't be pressing the alarm every single time. Okay? less than 30 seconds. We are done. Just go through it here. Nice. Oh, see, it's oversampling. See that? Wrap around. But is it in our spine? No, it's not. Nice pictures. Alright. We already took her out. Alright.